Transvaginal mesh operations usually result in minor pain or discomfort for a few days after the operation. Bleeding may occur for a few hours after surgery, but most women leave the hospital on the same day as the procedure. Patients usually resume everyday activities, including sexual intercourse, within 1 to 3 months of the operation. Although transvaginal mesh surgery is simpler and less invasive than more traditional treatments for pop and sway, it also carries a higher complication rate. In 2011, the FDA reported that it had received 4,000 reports of complications related to transvaginal mesh during the previous 6 years. Serious complications caused by transvaginal mesh. Although transvaginal mesh surgery is simpler and less invasive than more traditional treatments for pop and sway, it also carries a higher complication rate. In 2011, the FDA reported that it had received 4,000 reports of complications related to transvaginal mesh during the previous 6 years. Bleeding, pain, nerve damage, vaginal scarring, infection, vaginal shrinkage via scar tissue, painful sexual intercourse, neuromuscular problems, mesh erosion, organ perforation. Researchers have tried to determine how often transvaginal mesh implants cause serious complications, but studies have produced differing results. Complication rates range from 7% to 21%. Revision surgery for mesh complications. Severe complications, such as mesh erosion and organ perforation, may require surgery to fix. This surgery is referred to as revision surgery. Synthetic surgical mesh was designed to stay in the body indefinitely, so removal of the mesh is difficult. Vessels and tissues grow around the mesh, requiring doctors to remove it in pieces, one surgery at a time. Roughly 1 in 30 women who have a vaginal mesh sling inserted to treat incontinence will need surgery again in less than 10 years to remove or replace the implant, according to a study published in JAMA Surgery's September 2015 issue. The study, led by Dr. Blaine Welk of Department of Surgery, Western University, St. Joseph's Healthcare, London, Ontario, Canada, examined the cases of 59,887 women implanted with mesh for stress urinary incontinence, SWAY. The average age of the women studied was 52. The study's authors found that 1 in 30 women incurred a risk of undergoing a second surgery within 10 years to either remove or revise the implant. Urogynecologists receive special training in pelvic floor disorders, such as prolapse and incontinence. They're the most qualified surgeons to perform transvaginal mesh revision surgeries. Other treatments for mesh complications. In some cases, doctors try alternative methods to mesh removal. Doctors may prescribe vaginal estrogen cream to help the walls of the vagina heal on their own and manage symptoms, particularly if a woman is not sexually active. Then, she can follow up every few months to observe the erosion and make sure it doesn't worsen. If only a small amount of mesh is exposed, doctors may simply trim off the piece with a local anesthetic. Typically, this is an option when the amount exposed is 5 mm or less. This is a less complex form of surgery than complete mesh removal.